Good afternoon, everybody, and welcome to today's Zero COVID Coalition public meeting, Stopping the Virus. It doesn't have to be this way. Over the past year, we've seen that the spread of the coronavirus and the effects of the pandemic and how far-reaching it has been on our everyday lives. And in this country, unfortunately, we've been plagued with a government that has got it wrong and had been slow at every single stage. Now, over these past few months, I've seen activism spur up in a way that I haven't for such a long time, as many of the different groups and individuals that are going to speak to you today have taken the lead, led the charge, and put forward again and again the way in which the government should be going to not only stop the virus in its tracks, but protect people, their lives and their livelihoods as they go. As it currently stands, we're heading for 100,000 deaths in this country. This will be the highest death toll, not just in Europe, but in the entire world. And if we don't take stock now, if we don't head for a zero COVID policy, the situation will only get worse and the after effects will be long and far reaching. So today we're going to go through a number of different sessions with, like as I said, amazing speakers who have been leading the charge in many, many different ways. Our first session is what are scientists and medical professionals telling us now? As you'll know, again and again, we've been told we are following the science, but again and again, we see that is absolutely not the case. So we have a fantastic panel that are going to talk you through what is the real science at the moment and the ways in which they think we should be approaching zero COVID policy. Our first speaker on this session will be Richard Horton, who is the editor of The Lancet.
Thanks so much, Belle. Really appreciate that. It's exactly 1 year since we published the very first clinical description of the new disease that we now call COVID-19. And as you pointed out, we're hurtling towards 100,000 deaths in just a matter of a few days. And across Europe this past week, COVID-19 is now the #1 cause of death, overtaking heart disease. A failure, once again, to suppress the latest wave across Britain has allowed the virus to spread out of control and increase the probability of a new and more dangerous variant emerging. And indeed one has, a variant that is certainly more transmissible, maybe more deadly, but thankfully has not escaped vaccine protection. It seems that the current lockdown is now causing a plateau of infection. ONS data indicate a fall overall, although there are regional variations in the number of people testing positive. Meanwhile, our medical regulators and the National Health Service have moved magnificently quickly to roll out vaccines. But given the extremely precarious position we are in today, there are 3 critical issues that demand our attention. First, the vaccine program itself. We should be very clear that we have made a calculated gamble to delay the second dose of the vaccine. Pragmatically, argues the Chief Medical Officer, to give first dose protection to a larger number of people at a time when the prevalence of the virus is so high, but perhaps recklessly, others argue, because partial protection might increase the risks of another and possibly even more dangerous variant emerging. We urgently need evidence about the degree of protection 1 dose of the vaccine is really giving. The second issue is the strategy we are using to address ongoing outbreaks, because there is no strategy. What the government is offering is lockdown plus vaccination, and that is simply not good enough. Instead, we need a clearer objective, a phased plan to stop community transmission in order to establish areas that are proven to be virus-free, zero COVID. And once those areas are virus-free, to ensure that we have the systems in place, test, trace, isolate, travel advisories, border protections, genomic surveillance, to prevent reintroduction of the virus. To gain public support for this intensified collective effort, we need to go beyond the stay home, protect the NHS and save lives message, and instead focus on the objectives of well-being among our communities, especially the well-being of children and young people, especially mental health, creating the conditions for returning to work and for restoring civil liberties. And third, not only is there no short-term strategy, there is no long-term vision for where we want to be once we have established virus-free, zero COVID communities. The pandemic has exposed one of the most toxic injustices in our society, another type of transmission, the intergenerational transmission of inequality. So COVID-19 provides the political opportunity to intervene to create a fairer society, improving social mobility and unlocking human creativity in our communities. For example, by attacking child poverty, investing in early years services such as childcare and education in more socially and economically deprived parts of the country, and supporting young people in training and employment. We mustn't allow this woeful government to squander the chance it has been given to make our communities truly resistant and secure. Thank you.
Thank you very much, Richard. That was a perfect way to get us started with this panel. Our next speaker is going to be Jay Patel from Edinburgh University. Jay?
Hello, thank you. I want to build on the point that Richard just mentioned there, which is that we do not have a strategy at all. Instead, we're using this peculiar, almost experimental approach of having an influenza-style mitigation strategy. And that's, of course, not the right way to go. It's also dangerous. Warning signs have already been issued. We've seen the emergence of variants that are more transmissible and potentially more lethal. But they only emerge when the conditions are ripe for them to do so. Mutations are indeed random, but the political failures fuel the conditions for those to emerge. They do risk undermining the vaccines that we have. And although vaccinologists, immunologists are confident that those vaccines can be modified, it's a huge logistical challenge to deliver them to populations. And to use that in addition to lockdown release cycles are simply unsustainable. So we urgently need to pivot towards a zero COVID strategy. The two questions that tend to emerge are, is this something achievable in the United Kingdom? Because we know international approaches have shown that this is successful. And the resistance normally involves several points. One of the very first concerns was that a zero COVID strategy would be absolutely impossible to achieve. And yet China managed to do so very early on. And then the comments emerged that actually you can't achieve this in a democracy, to which Taiwan showed that you absolutely could. They then modified their statement to suggest that it's not achievable in a Western democracy. And of course, New Zealand is an approach that has shown that. It's not achievable in a big country, they say, yet Australia is rather large. And they're all islands. Well, we're an island too. And so this approach is absolutely reproducible in the United Kingdom. And the next question emerges, well, is this all too late? Have we perhaps missed the boat to achieve this? Well, this year is not going to pan out like the last. There are some incredibly concerning challenges that we need to address. And the only way to address it is through a strategy that prioritizes in the short term maximum suppression with an eventual view to eliminate a zero COVID strategy. Thank you.
Thank you very much, Jay. I think it's very important that you've laid out just how achievable a zero COVID strategy is at this time as people continue to doubt it. Now, our last speaker in this session is Robert West, who is from Independent Sage. You would have all heard about Independent Sage at some point if you've been listening to the news surrounding the coronavirus pandemic. At each and every point, they have been presenting the science to the public as it is, and not making weird interpretations of it, as unfortunately we've seen the government do. So I'm very pleased to be hearing from Independent Sage today. Robert.
Thank you. Thank you very much. Yeah, so I just want to, again, build on what Richard and Jay have said. And I'm just going to cover two things. One, why it's necessary now to go rapidly, urgently towards a zero COVID approach. And then why that is achievable now. And the first thing to note is that with around 100,000 deaths, it's worth remembering that that represents around somewhere between 12 and 15% of the population having been infected. That means that we've still got roughly 85% of the population yet to be infected. Bearing in mind that the R0, that's the rate of infection when you don't do anything, was somewhere in the region of 2.5 to 3, with a doubling time of 3 to 5 days. You can see how very, very quickly things can get out of control. And if we don't really bear down on it really quickly and really hard, that will happen. The other thing that's worth bearing in mind is that the infection fatality rate is around 1%. That's about in this country, with the age profile that we've got and so on. The infection hospitalization rate is around 4%. That's a lot of people being put in hospital. So it's necessary. We can't rely on the vaccine because we will not get complete coverage. The intention to receive the vaccine is around 90% at the moment, but it varies from community to community. And in addition to that, we know that the vaccine, even the Pfizer vaccine, for example, in the best of circumstances, is only likely to provide somewhere around 90 to 95% effectiveness. So you can see why it's so important. And of course, lastly, that we need, that we have the issue of the potential for vaccine escape. That is, the mutations arising that will make the vaccine less effective. Why is it achievable, and why is it achievable now? Well, the thing that has been alluded to, which I think is probably the single most important thing here, is that although adherence to the rules and guidelines has generally been very high, and we haven't seen this pandemic or COVID fatigue that people have been talking about in general terms, there is one behavior which has been very low throughout and remains low, and that is isolating when you have symptoms, and also isolating when you need to because you've been in contact with someone who's got the disease. That is currently running at around 18 or 19%, and that is catastrophic. And the reason why people are not self-isolating is not because they don't care or because they don't want to. It's very largely because they don't feel that they can. And that is where the support for isolation comes in. And the government's approach to this has been very different from that in countries that have been successful in both the first and second waves, because what they have done in those countries that have been successful, like Taiwan, Singapore, New Zealand, and so on, is that they have had a much, much better and much stricter regime for enabling people to self-isolate and making sure that they do, and that's going to be really important. The other side of things, very quickly, is around border controls. Our border controls have been absolutely woeful in this country, and they still are. And we need to address that, because even if you get down to a near elimination strategy in your region, you've got to prevent the virus coming in from outside, and that can be tackled. It can, this is not that hard, and other countries have done it. But with all of that, we need to mitigate the damage that's done by these measures to people's lives. And again, that's an area where the government hasn't succeeded, but it can, and it could do it tomorrow. Thanks very much.
Thank you very much, Robert. Thank you very much for that and for everything that Independent Sage has been doing to keep the public informed. We are now going to, before our next panel, go to hear from Richard Bergen, MP. One of the questions that keeps being asked when we talk about a zero COVID strategy is what exactly do we mean? And it's really, really important question to ask. Obviously, what it's saying is that we're aiming to eliminate the virus, but people need to be clear about exactly what it is that it's going to take for us to get there. So, Richard.
Thanks very much, Belle, and thanks to the Zero COVID Coalition for today's fantastic and important event. I fully back this initiative, and of course, will do whatever I can to support it. And I want today to look briefly at two issues. Firstly, why a zero COVID plan is still needed, despite the great news of the vaccines. And secondly, the concrete demands that we will need to be campaigning for. Now, I want to start with one key fact illustrating why we need a zero COVID plan. In the first 2 weeks of 2021, the UK recorded 12,500 COVID deaths. That's way more than the 7,000 deaths in all the zero COVID countries put together over the past year. In 2 weeks, the UK had more deaths than China, South Korea, Thailand, Australia, Singapore, New Zealand, Taiwan, and Vietnam had in a year, despite their total population being 20 times greater than ours. Preventing the unnecessary loss of tens of thousands of lives should always have been the priority. But even on the economy, our government's policy has been a disaster, with the UK having one of the deepest recessions of any major economy. In contrast, the zero COVID countries are safely reopening, with sports stadiums packed to rafters, nightclubs and shopping centres full and safely so, and with their economies recovering too. And what's so frustrating is that could have been us. We had cases down to 1 per 100,000 people in early summer, on track to being able to eliminate it before the government acted so recklessly. Now, some people believe that the vaccine will be a silver bullet that soon deals with this crisis once and for all. And while the vaccine is a key weapon in this battle, it can't be the only one, because it will be many months, perhaps the end of the year, before everyone has had the vaccine. And even then, children won't have had it. And we still don't know if and to what degree the vaccine prevents transmission or how long immunity lasts. But even in the best case scenario, without action, the virus will continue to spiral out of control and infect millions of people. That means many more people falling ill, with the risks of long COVID very serious. It means an intolerable strain on our National Health Service, where intensive care units are already at capacity. It means staff and resources taken from other areas, creating even greater backlogs for hospital treatments, including for other deadly diseases such as cancer. But perhaps most seriously is that if the virus continues running out of control, there's a real danger of it mutating again and again, perhaps into variants resistant to the vaccine. So the fight for zero COVID must continue. So what are the campaigning policies that we need for a zero COVID plan? Zero COVID seeks to effectively eliminate the virus through a maximum suppression strategy. That means driving cases down to very low levels and then using test, trace, isolate and support to keep them down. Our policy demands must reflect that strategy. So the first demand is to lock down properly. Lockdowns represent a failure to have the disease under control, but once it's out of control, they're needed. But if you are going to do it, then do it properly. So we need a lockdown that lasts as long as is necessary to get cases down, not just a few weeks. But we also need, crucially, the government to give people the financial support they need to stay at home through lockdown. The data shows too many are having to go to work during this lockdown. So a key demand must be furlough on full pay for all workers who can't work from home, and urgent financial help for the millions of self-employed people who've never had any support and so still have to go out to work. But permanent lockdown isn't a solution. So what else do we need to stop us going in and out of lockdowns. Obviously, any successful strategy needs testing and tracing to work. So we must use the lockdown period to fix it. That means campaigning to kick out Serco and all the other privateers and investing in our NHS, especially in local public health teams. But testing isn't the goal in and of itself. The goal is to get infected people to isolate. We know many can't isolate without proper financial support. The government's £500 isolation payment is too low and it goes to far too few. That's why I've been organising a group of MPs to demand statutory sick pay at real living wage levels. We also need to fight for other types of support. For example, there's thousands of empty hotels that should be made available to those struggling to isolate because of cramped housing. We also need to be planning now for the safe, gradual opening. Schools are rightly currently mostly shut, but eventually they'll reopen, so they must be made safe. That means campaigning for smaller class sizes by rehiring teachers and using community spaces. It means a rota system in place for schools with teaching both online and offline. So let's step up the fight for laptops and free internet access now. Likewise, university campuses should stay shut this academic year, with teaching mainly online, fees scrapped and replaced by public investment, and students fully reimbursed for the costs of accommodation they can't use. In conclusion, these are just some of the key elements of the Zero COVID plan. There are others, such as managed quarantine, but getting there requires a political solution. That means a campaign inside and outside of Parliament to put maximum pressure on the government to change track. Today's event is a great start. Together, we can win that change of strategy.
Thank you very much, Richard, for setting that out for everybody about how we can achieve our zero COVID strategy in this country. You touched on what the impact has been on people's lives, and that's very important. And the title of our next session, the impact on real lives and real people. We've seen just how much the pandemic has exacerbated many of the inequalities we already see in society. It's exposed issues of workplace safety. It's exposed just how bad many of our services, our public services, have been, and how much people can be left out in the cold by this government. And we've got a fantastic array of speakers on this particular session. And we're going to start with Jeremy Corbyn, MP. Jeremy?
Thank you, Belle, and thank you, Diane, and everyone that's organised this excellent call today, and all the work that's been done on a zero COVID strategy, because it is obviously central and very important to everything we're doing. I think the most dramatic statement I heard in the last week was the Director General of the World Health Organization, who said it's a moral catastrophe that the 49 richest countries in the world have dispersed many millions of vaccines already. The majority of countries in the world, the poorest majority of countries, in some cases have had almost none. And in one of the very poorest countries in the world, just 25 people of the entire population have been vaccinated. And so what we're seeing is all the inequalities that we've talked about on previous calls writ large on the global stage. And when the World Health Organization pointed out that we're in a pandemic last January, a pandemic means what it says. It's the whole world. And unless Corona is conquered everywhere in the world, then it will come back to bite us again and again and again with various mutant forms of it. And that is why we have to support the World Health Organization and properly fund it. And it is good news that President Biden has now decided that the USA will re-enter the World Health Organization, but I hope they re-enter it and fund it properly when they do go back in. But what COVID has also shown is the complete inadequacy of the government's response. They were told to test a year ago and they didn't. They were told they had to trace just under a year ago and they didn't. They were told they had to ensure that people could isolate safely. They haven't done that. All along the line, there's been one bad mistake after another. And as Richard Bergen just pointed out, at every turn, instead of properly funding our NHS and care services, they've thrown money at the private sector. So we have, a year on, COVID billionaires and a lot of people who are very poor and very stressed as a result of COVID. And that means that the campaign now is about a furlough scheme that is worthy of the name. It is about not cutting universal credit, but instead increasing universal credit, and about increasing statutory sick pay. But it's also recognizing that this is, I think, a time for national reckoning. There are people who've made a lot of money out of COVID, Big Pharma and companies like Serco and others that have had contracts thrown at them. For the majority of people, it's been very difficult and very hard work. The levels of mental stress are absolutely huge, and the levels of mental stress amongst those that are isolated are huge, and those in work that are huge. Think what it's like working in a hospital, a care home, or anywhere else, or a school, or on the emergency services. And it's that sense of isolation that has to be dealt with. And it can be dealt with by a proper mechanism of support and proper funding of people. But it also means that this is a time of national reckoning about our society. Just over a year ago, I was being condemned for wanting to spend a lot of money on investment in public services. And I was also ritually condemned by every newspaper, with the exception of the Morning Star, which is on this call today, of saying how reckless it was to propose universal free broadband. It's absolutely essential that everybody has access to online services. Every student and every child has access to online services. And it shouldn't be down to wonderful charities raising money to provide computers for young people. It should be down to society as a whole to recognize nobody should be left behind. And that surely is the fundamental. And so let's ensure that the economic debate that's now going on isn't how we manage the next phase of austerity to pay for the corona crisis. It's how we invest for the future, tax fairly. That means taxing big companies that have made windfall profits out of COVID, and it means redistribution of power and wealth within our society. We've seen the best and the worst in our society. The worst has been the greed. The worst has been the deception and dishonesty of people in very prominent places. The best has been the professionalism in the NHS, in the care, in local government, and the best has been the determination of all of us in our communities to ensure that everyone is fed, and those that are sadly very isolated and going through mental health crises get the support that they need. And that spirit is a spirit of social justice, and it's that spirit that I think will defeat what this government's plans are for a whole new round of austerity if and when the deepest restrictions are lifted. And I'll just finish on this point. Richard Bergen gave the figures, and he's absolutely right. It's the negligence of government, it's the delay on decisions, it's the incompetence, it's the inefficiency that has cost thousands and thousands of lives that need not have died because of corona, that could have been supported and saved if we'd had an efficient system, as many other, actually much poorer countries than ours managed to achieve. That's got to be the message. But above all, be united and strong in our determination for a fair and a just society. Thank you, Belle.
Thank you very much, Jeremy, and you're absolutely right. And what I would say is certainly coming out of this pandemic, there will be a generation of people that demand free broadband as a right, and they'll be absolutely right to do so. Thank you very much.
You're welcome. I'm sorry I'm speaking from a car.
That's the beauty of being able to do this on Zoom.
Well, I was going to do it outside in the snow, but I thought you might have just felt too sorry for me.
Yes, I would have done. Thank you, Jeremy.
You're welcome.
Our next speaker is Dr. Coral Jones from Doctors in Unite. She's going to be one of our first trade unionists speaking today, and we all know just how much our trade unions have been working hard since the beginning of this pandemic, helping to force a lot of the U-turns that we've been able to get from this government, and continue to fight today. Dr. Jones.
Hello, thank you very much for organising this fantastic event. I bring solidarity from Doctors in Unite the Union and also from the London branch of the Socialist Health Association, of which I'm chair. Doctors in Unite called for a zero COVID strategy from last May. But why do we need a zero COVID strategy? As we've heard, it's because it works, and without it, this disease isn't going to go away. We now know that the primary transmission of COVID is airborne. That means virus fills small rooms quicker than big rooms, and without ventilation, whether in large or small rooms, stays there for hours and infects people. No one must be forced back to schools or workplaces without assessment of ventilation, safe distancing, mask use and cleaning. It's not enough for Labor to say, we've got to rally, we have to support the government. Labor must complete the sentence. We will support the government when it is safe for people to return to work or school. For zero COVID strategy to be successful, everyone must be included. If anyone is left exposed, everyone is exposed. The Socialist Health Association campaigns for the rights of refugees, migrants, and asylum seekers to have access to the NHS, including for COVID treatment and vaccination. People without NHS numbers and not registered with GPs are excluded from vaccination. Even some NHS staff without NHS numbers have been refused vaccines. But many people are afraid to register with GPs or attend hospitals, as they might be put at risk of detention and deportation from the hostile environment. So the Labor Party must oppose the legal requirement for the NHS, schools and councils to report people to the Home Office if they're unsure of their immigration status, and campaign for healthcare for all. A zero COVID strategy depends on an all-inclusive public NHS, cradle to grave and free at the point of use. Prior to the pandemic, the NHS was already depleted. The UK has the third lowest number of beds, doctors and nurses in the whole EU. So the COVID pandemic highlights that the NHS needs spare capacity and not a reduction. But however, COVID has been used, as we've said already, to bring the private sector further into the NHS, to give bulk contracts to Tory cronies, spending billions on failed track and trace and PPE. And then in April, there'll be a crash landing of ICSs into the NHS, that is integrated care systems. England will be divided into 44 regions, and unsurprisingly, they're modelled on the American corporate care organisations, where every dollar spent on health is seen as a loss. So for integrated care systems, integration aims for one large organisation overseeing many contracts, and will cause fragmentation and competing interests. So that means not integration, but no joined up thinking. Care here stands for cut budgets with restrictions on access to the NHS. And systems is legislation to embed the private sector in the NHS. Corporations are already deep in the heart of decision-making and pocket the profitable parts of the NHS. A zero COVID strategy needs a truly integrated NHS and public health system. Post-COVID, we'll need our NHS more than ever. Labor must campaign for a publicly run, publicly provided NHS, accountable to us and not to shareholders, and against the top-down imposition of integrated care systems. So as we've heard, we cannot simply vaccinate our way out of COVID. We need a zero COVID strategy integrated into a public NHS with health care for all people. Thank you very much.
Thank you very much, Dr. Jones, and thank you very much for all that you and the Socialist Health Organisation continue to do.
Thank you.
If you are tweeting about this event, the hashtag we are using is #ZeroCovid. It's now trending online, and we'd like to keep it this way throughout the rest of the event. Our next speaker is Keith Venables from Health Campaigns Together. They have been standing firm against cuts and privatisation in our national health service, something that we can see being done by stealth throughout this pandemic. Keith.
Thank you, Belle, and thank you for inviting us to speak. Health Campaigns Together was set up in 2015 to offer campaigners, political organisations and unions the opportunity to build the capacity of the movement to fully reinstate our NHS. Our affiliates stretch across the country. The first time we shared a platform with Jeremy and the others on this call today was in March 2017 at our 250,000 strong London demo for our NHS. It shows that we can do that the public are behind that. We can organise when we can organise in that way and other ways, we must do so. We fully support the zero COVID strategy because we've seen and heard the impact of this government's failed strategy on patients, on families, the community, all key workers and unions. There is distress and anxiety among workers fully feeling undervalued, underpaid and exhausted. We need a zero COVID strategy. Finally, with our sister organisation, Keep Our NHS Public, we developed a rescue plan for the NHS. This can be found on our Health Campaigns Together website, along with a call to our conference in February 25th called Pandemic and Privatisation. Thank you, Richard, for the phrase. I think it was Richard who said, we should not throw money at the private sector. This matters. Thank you for Jeremy, the comment, Tory cronies are what we must fight against. So please, solidarity to all of those involved in this fight for a COVID safe and full NHS. We will fight and we will win. Thank you, Belle.
Thank you very much, Keith. And one of the things that's certainly come out of the pandemic is, as I said earlier, just how much it's exacerbated existing inequalities, and none more so than the racism that we see daily. And so we're pleased to be joined by Zita Holborn from BARAC, Black activists rising against the cuts. Zita.
Thank you. And I'm here to speak on behalf of BARAC and PCS Union. So solidarity from those organisations. Thanks, Belle. Yes, earlier, it was mentioned that existing inequalities have brought out the worst through the pandemic. But actually, it isn't just about inequality. It's about discrimination. It's about the discrimination that we've faced for many years in the labour market and in wider society, and not just inequality. Black workers and Black communities are amongst the hardest hit by this pandemic because of the existing discrimination they faced. We faced before this pandemic hit us, but there's also an impact on women, there's an impact on disabled people, on older people. So if you look at all equality groups across the board, there's going to be some kind of impact. And all of that stems from the discrimination that we faced before. So not only are Black, and when I'm using the term Black, I'm referring to Black, Asian and minority ethnic people. Not only are we contracting and dying of the virus disproportionately, we're more likely to lose our jobs. We're more likely to be in vulnerable roles, precarious roles, where we're on the front line and most at risk of the virus. And it's exasperated and amplified the existing discrimination that we face, not just in the last couple of years, but for over a decade. Discrimination was already deepening every day when this pandemic hit us. So there's an impact on key workers who are having to go out on the front line, who have been keeping the country running, keeping services, essential services running in the civil service where PCS members are based, in the NHS, in hospitals, and so on and so forth. But also there is the impact on facilities workers, people who are also some of our union members in PCS who work as cleaners, as caterers, as security guards. There's been an impact on transport workers. And there's recent statistics being published that show us that in all the industries with the biggest fall in employment, these are the industries where there's the highest rate of Black and migrant workers, but also industries that we may not typically think about. So I'm also the joint chair of Artists Union England, and we're really concerned that there's been a fall of 44% of Black workers in arts and entertainment during the last year. And there's an impact on children. It's already been mentioned that you know, children can't even conduct their studies at home because in some families they're having to use one mobile phone belonging to a parent, and you're talking about an entire family of children and parents trying to work and study off of one phone. And that's because of the poverty that already existed for those families, meaning that they're not even paid enough to make ends meet, let alone go out and buy a laptop or a tablet to be able to conduct their studies and work on. And when we look at those people with no recourse to public funds, these were people who were able to work, who've lost their jobs and not been furloughed because they were working in precarious roles in private industry. But they're not allowed to claim any benefits or any government measures. And over the last year, Barrack coordinates humanitarian aid distributions to refugees in northern France. And we've been directing some of our funds and support to families with no recourse to public funds, because they've been entirely dependent on charity and local COVID support groups just to survive and have anything to eat from one day to another, let alone any other essentials. And this is a breach of human rights because it's included families who have had babies during the pandemic and haven't even got the basics that they need for their families. And the impact on those who are refugees, people who are displaced because they're fleeing the impacts of climate change, of persecution, etc. They're not even in the equation when it comes to protection, when it comes to vaccination. We can't leave anybody behind. Last month, I was campaigning against the deportations to Jamaica, and there have been many deportations during the last year. There's been no tests in detention centres or before people are deported. There's been outbreaks of COVID in detention centres, so they've had to close them down, and no concern for the impact on families left behind of losing one family member at a time when families are already struggling to survive. So we can't leave anybody behind. Everybody needs to be included. The human rights of everybody has to be considered when we're going forward. And when it comes to, and I'm finishing, Belle, because I know I'm about to go out of time. This is my final point. When it comes to the vaccination, and we're looking at who have they categorized as being at high risk and who's the next group of people to be vaccinated, Black people haven't been included in that. even though we're dying disproportionately, which is an absolute disgrace, and that needs to be addressed as well. And I know there are competing priorities between lots of people who say we're a priority group because of the job we do, because of the equality group we belong to, but you have to take all of that into account if you're serious about protecting those who are at most of risk. And final point, we don't want to go back to normal. Normal was discrimination, it was poverty, it was abuse. When people talk about going back to normal, no, what we need is a new future which is positive and equal for everybody. Thank you, Belle.
Thank you very much, Zita. And you're absolutely right. When we're looking towards the future, we need to be thinking about making things better than they have been in the past 10 years of austerity. No return to that normal, most certainly. Now, we have over 2,000 people watching this event over many different platforms. As I said, if you are tweeting, please use the hashtag #ZeroCovid and follow the campaign on Twitter at #ZeroCovidNow1, also on Facebook. Our next speaker is Sabi Dalu from Stand Up to Racism, who have been campaigning throughout the pandemic. Also, Sabi.
Thank you very much, Belle. I'm very pleased to be addressing this meeting today. We fully support the launch of this very important Zero COVID Coalition, and we've also been calling for a Zero COVID strategy. I'm here to address the scandal that has been the disproportionate impact of COVID on BAME communities and why we're calling for a public inquiry. Now, I want you to cast your minds back to spring 2020, when there was daily coverage of the disproportionate impact of COVID on Black, Asian, minority ethnic communities. And the organizations like the Office for National Statistics and the Institute for Fiscal Studies and many others conducted a lot of research that showed that race was a factor in of itself, which did mean that people were more likely to be disproportionately impacted by COVID, along with age, gender, geography, and so on and so forth. You then had the explosion internationally, starting in the United States, of the Black Lives Matter movement following the grotesque killing by the police of George Floyd. And it's no accident that the Black Lives Matter movement emerged in the context of the COVID crisis, because in the United States and here and in other parts of the world, COVID has disproportionately impacted on Black communities. And it's not just the health impact of COVID, also the economic ramifications of COVID, you know, furlough, job losses, and that sort of thing, Black communities were disproportionately impacted. And in fact, BAME communities were less likely to be furloughed than their white counterparts and were more likely to lose their jobs. And what we've seen since then by the government here is, instead of addressing institutional racism, instead of addressing the issues that led to the disproportionate impact of COVID on BAME communities, we have seen a suppression strategy. So instead of suppressing the virus, the government has been busily suppressing information on institutional racism, structural racism, and the factors that have led to the disproportionate impact. In the summer last year, the government attempted to suppress the Public Health England report, which addressed institutional racism and tried to address some of the issues that led to the disproportionate impact and stop that from happening. But they were forced to do a U-turn. One of the many U-turns by the government was the fact that they were in fact forced to release the Public Health England report that dealt with racism and so on and so forth. But in the autumn, the government tried to deny that racism was a factor in the disproportionate impact of COVID. They were trying to make out that the Black communities that were disproportionately affected were because of, socioeconomic factors, and downplaying the significance of race. Now, this flies in the face of what the BMA have recommended, what Doreen Lawrence recommended in her review into this issue, and what one of the key demands that they raised was that we need data collection in real time. So when people are dying, we need to know their ethnicity. When people are testing positive, when people are being admitted into hospital, we need to know their ethnicity, because if you're not collecting that data, then you don't know what is the disproportionate impact. That data is not being collected right now. So that is why you're not seeing on your screens, on your radio, on the internet every day, the disproportionate impact of COVID, because it's not mandatory to state race and ethnicity on death certificates, and the information isn't being collected. So last year, the ONS and the IFS, they were actually doing a lot of work into cross-referencing the death certificates with birth certificates, with the census, and that's how they collected that information. That's obviously a lot of work. It'd be much easier if we were collecting that data in real time. So that's not happening right now. And that is a cover-up. And that is why we are demanding that that data is collected immediately. And we are demanding a public inquiry like the Stephen Lawrence inquiry into institutional racism and the disproportionate impact of BAME communities in this country. It is a scandal that we are dying disproportionately. More than 100,000 people have died, and a big chunk of that, tens of thousands of that, is Black community. So we demand a public inquiry now. Thank you very much.
Thank you, Sabi, and thank you to Stand to Racism for leading the charge on the public inquiry, something that we absolutely need sooner rather than later. We're going to move on to our next speaker, and thank you so much to all of the speakers for keeping to time. You're doing great so far. Our next speaker is Karen Reisman from People Before Profit. Karen.
Thanks very much for inviting me to speak today, and thanks for holding the conference. I think it's really, really important that we do have this conference. Clearly, the government have said from the beginning that their strategy is partly to avoid the NHS being overwhelmed. Well, I have to tell you that that strategy has failed. The NHS, I think, is officially overwhelmed. We have not only, and we didn't have enough beds before, we didn't have enough staff before, we didn't have enough anything before, but actually now we are turning down and closing the majority of non-COVID care. And we're not dealing with COVID in terms of we're not able to provide what we can do. Just some simple facts, like the fact that there are people who are breathless today in the 6th richest country in the world who will not get the oxygen that they need because we're having to ration oxygen. We're rationing equipment. We know that there are people who desperately need to have that in order to literally to get breath into their lungs, who we're having to say, well, shall we give it to that person or that person because we haven't got enough equipment. We are overwhelmed, and it is absolutely awful. It is horrific for the people, the patients who are unwell and are needing that care. It's horrific for the families who can't even be with them because of the restrictions, because of the nature of the infectivity. It's horrific for the staff who are traumatized having to do that. And in a way, one of the worst things about it is that it is unnecessary, absolutely unnecessary. It comes on the back of 10 years of austerity that did untold damage to our public services, but it also comes on the back of them having absolutely no thought through strategy for how to deal with COVID. So their management, time and time again, seems ad hoc rather than planned, doesn't have an end in sight, and they're constantly looking over their shoulder for profit. And I think it's not easy. There aren't simple solutions, but there are things that they could easily have done. They could do a proper lockdown. There are 20 million people in Britain working every day, and a lot of those are not in essential services. They're in manufacturing and all sorts of areas that could be closed down. They should be at home and they should be paid properly. There are thousands of beds, of staff, of equipment, of oxygen in private hospitals that could be nationalised today to alleviate that very pressure, so people who can't breathe can have the oxygen that they need. They could give all migrant workers and all asylum seekers both the right to work and the right to remain, because there are thousands and thousands of medically qualified staff who are told they are not allowed to work, when we know that an ICU nurse that should be working one patient to one member of staff has got 4 patients and therefore not able to do it properly. And lastly, they could pay the NHS staff properly, so that we wouldn't feel as disheartened and as unvalued as more and more of us are dying. I'm from People for Profit, and I think it's vital that we have the arguments about public health and about safety. But on top of that, we have to have the arguments about economic support, about the things that other people have talked about in terms of isolating and furlough. Because undoubtedly, the fact that they failed on health means that they failed on the economy. And when they failed on the economy, even though there are businesses that are making huge profits, they're constantly trying to get workers to pay and to scapegoat. And that's why the emergency programme that we've developed, that you can have a look at on our website, does try to draw together a set of demands that links those linked to safety to those linked to economy, to those about safety. And I think that, you know, the support for the fight of jobs, you know, is an important one. What they did at Rolls-Royce is absolutely crucial, and solidarity is a key part of that. But I think lastly, I want to say is that it's important that we don't just have these meetings, which are fantastic and are a part of trying to maximise sort of support, but we also look at what action we can take. And it's difficult because of the virus and the nature of what we have to do to protect ourselves. But if we don't take those actions, we leave the pandemic in the hands of the government, who we know are going to make the same errors over and over again. There is nothing that suggests that. So whether it's fighting over PPE, whether it's the Workers' Memorial Day protest, whether it's the fantastic action by the NEU and Unison over stopping schools closing in June or January, I think it's important that we take those actions. We've got a meeting just after this meeting of People Before Profit, where you can carry on the conversation if you want to. Diane Abbott will be speaking, but I think it's crucial that we not just talk about what we're doing, but we plan and organise to take the action that takes control back off the government and into the hands of people who actually do care about whether people are dying and about their livelihoods.
Thank you very much, Karen, for all you've been doing with People Before Profit. You're absolutely right. Where there has been organisation, we have seen major wins. Now, one of the things that has been exposed the most during the pandemic is the issue of safety at work. What we're asking from our key workers often is to go into places. At times it has not been with the right PPE, and they in turn are putting their families at risk when they come back home. And there have been a number of different cases of people dying, key workers dying during this time, and stories about them not being provided or not receiving the level of care and safety procedures at work. But one which has really grabbed the hearts and minds of people right across the country, with over 2 million people signing a petition for a public inquiry, is the campaign of Belly Majinga. And we've got Lawrence Davies here from the Belly Majinga campaign.
Thank you, Belle. Just want to pick up on a couple of things that other speakers have said first, just to support Sabi's call for a public inquiry on racism and the impact of racism during the COVID period. And also something that Karen just said, which is quite incredible, that as the 6th wealthiest nation in the world, we're having to rationalize oxygen. And just to tell a story that I'm aware of through a friend, her uncle realized he wasn't going to make it, and knowing about the need to rationalize oxygen, actually volunteered to switch his oxygen off, which meant he died within 2 to 3 hours of that, so that other people could take the benefit of that. We really just should not be in that situation. I want to talk about the unenforceability of workers' rights, especially during the COVID period. But if you look at the pre-COVID workplace, after the Brexit campaign, we knew that racial harassment in the workplace had increased from 16% to 31% by 2020. So that was a position in January 2020, But we also knew that only 1% of the victims of racism in the workplace actually formally complain about that racism, which also means that 99% of incidents of racial harassment in the workplace never get challenged, which perpetuates the system and empowers the bullies that harass. And that is due to a culture of fear in the workplace. So while COVID doesn't discriminate, we know now that the impact of COVID does discriminate, and that's because COVID operates in a system which is based on systemic inequality. The reason why workers don't challenge why there is that culture of fear is because they fear the retaliation if they do complain of discrimination, also because the justice system as it presently is constituted isn't effective, it's not fit for purpose. So you have these bizarre barriers to justice, such as if you buy a defective television, you have 6 years to bring a claim to court about that defective television. If you're personally injured, you have 3 years to complain to a court about that personal injury. If you're personally injured as a result of racial discrimination, you only have 3 months to complain. There's just no reason why there should be 6 years for challenging a defective television or breach of contract, 3 years for a non-discriminatory personal injury, but only 3 months, less 1 day, to challenge racism. We know that the awards are pitifully low. The average award for racism is £12,000. In 2019, the highest award in the UK for race discrimination at work was £33,000. Okay, last year we smashed it on a case called Angira Amu, which we ran, and we recovered 386,000. But that's just a tip of an unenforceable iceberg in which 99% of victims don't even bother to formally complain. So then if you morph that situation and transfer it into the COVID era, what you have is Belly Mujinga working for Govia Thameslink at Victoria Station as a ticket officer. She's already complained of racism in a formal grievance, which makes one of the 1% of people who formally complain about racism at work. That race grievance was completely ignored by the employer. The grievance was against a supervisor who sent her out to work on the platform on the 21st of March. The supervisor had no reason or need to send her out on the platform, and the employer, we believe, was aware that Belly had an underlying respiratory condition. And if you've seen her video of about the 17th of March, where she talks about her sheer fear of having to work outside, you'll know she did not want to work outside that day. Also, what you might not know is the employer had not provided any PPE in terms of face masks to their staff and had banned their staff from wearing face masks to give their customers better service. On the platform, she was assaulted twice by a large white male. That incident, the man in question said he had COVID before he coughed and shouted, and spittle hit both Belly and her black colleague. Both then contracted COVID, and we know that Belly died on the 5th of April 2020. BTP were not informed of the assault by the employer at any stage, not at any stage. The BTP eventually caught wind of the fact that somebody had died in those circumstances and investigated in May 2020, and they concluded that no criminal assault has occurred. We now want to bring a civil action in relation to that under the Protection from Harassment Act 1997. But the BTP will not give us the name of the white male perpetrator, even though we only want it to pursue that guy in the civil courts. It's bizarre, and we're now having to formally complain about the BTP for being institutionally racist. And one of the unusual aspects of the Belly's case is it turns out the BTP are not funded by the Home Office, but they're funded by the train operating companies, including Govia Thameslink, which is another thing we want the coroner to look at. And we're still calling for a coroner's inquest in relation to that. So there's this culture of fear, which has been long-standing at work. And what's happened during COVID? We know about Belly's case. I personally, as an employment lawyer, have been contacted on many occasions by workers complaining that they've been forced to work in an unsafe working environment. But guess what? None are prepared to formally complain. Over the whole COVID period, I've had tens, if not more, of complaints, possibly over 100 now, of health and safety breaches by employers, but only one claimant has actually taken the decision to formally complain to a tribunal about that, because everyone else is too scared to do so. So when faced with an unsafe working environment, no social distancing, inadequate PPE, most workers are forced to continue to work in that environment or to go sick, or absolutely tragically, they're too scared to go sick in case they get sacked for going sick. And that's the present position on the ground. We still have 99% of victims of racial harassment not feeling able to challenge that formally. And the last thing I probably want to say is, please do not think we live in a compensation culture. We live in a no complaints culture, and that has to be addressed. And so when you're looking at the exit agreement by which we've negotiated terms to leave Europe, be aware that the government now intends to look very, very closely at workers' rights. And I don't think anything that they have in planned for workers' rights is going to increase the enforceability of those rights. And we must do something about that, or more people will be left in a situation of Ballymajinga, in which you're working on the front line with inadequate PPE, you're exposed to racial assault on the platform, no one does anything about that, you die, and justice is not achievable, which would be an absolute tragedy. Thank you.
Thank you very much, Lawrence. Thank you. We're going to go straight on to our next speaker, who's Dr. Emma Runswick from the Zero COVID campaign.
Hi, thanks very much, Belle. My name's Emma, I'm a junior doctor in the Northwest, and I'm a BMA rep, and I'm speaking from Zero COVID campaign, which is an independent campaign for an elimination strategy to save lives and livelihoods in the UK. I'm seeing a lot of COVID at work. The virus causes damage in the lungs, but also in the brain, heart, kidneys, and other organs and systems. And as Richard said earlier, about 3 or 4% of people who catch COVID need respiratory support. And that's not pleasant. For some people, that's oxygen through small prongs in the nose. For many, it's oxygen at continuous pressure at about 30 miles an hour to the face. For some, we paralyze you, put a tube down your throat, and take over, making you breathe. And the people needing that kind of organ support in ICU have overwhelmed our ability to provide it. As Karen said, we've got 1:3 or 1:4 nursing ratios in critical care. And that is not high quality care, however much we try. We've opened new wards and expanded into barely suitable spaces without additional staff. Care for non-COVID, non-emergencies has all but stopped, storing up our problems for later. And we don't have a cure for COVID. We support your body as you fight the infection. So in our wards, we watch people die, often alone. And those who survive might not survive well. ICU is a traumatic and damaging process. Even those who aren't requiring hospital care, about 10% of them get long COVID. The effects of that are primarily fatigue and muscle pains, but we're also seeing increased risk of serious conditions, so 10 times increased or 12 times increased risk of stroke, 9 times increased risk of diabetes, 10 times increased risk of kidney failure. So that's the impact on real people, real lives, whole families admitted into hospital, people in their 30s and 40s going to ICU. And that's horrible to see. The government has put all its eggs in the vaccination basket. And the argument about vaccine timing that has dominated the BBC last night and the papers this morning has come out primarily because they aren't willing to take the public health measures required for elimination. And secondly, they haven't got the supply required to vaccinate everybody properly. So the claim that the delay of the second dose will save 6,000 lives by enabling more people to have their first dose of vaccine is undermined firstly by the thousands of deaths we'd seen since Christmas because of their lack of public health measures. Secondly, by the evidence in Israel that shows that first dose vaccination doesn't provide the protection we would like it to. Thirdly, by the damaged sickness absence in the NHS, as people who have only received a first dose have to take more time off for COVID. Fourthly, by the damage to NHS and other key worker morale. And then finally, by the fact that blooming estate agents and the DVLA and car production factories are full of workers. And finally, by the fact that we still have people who cannot afford to isolate. So in that context, we need a much wider campaign. Even large sections of the left, unfortunately, aren't going to get behind a campaign run or organised by the Morning Star. Zero COVID aims to have a grassroots supply. We've got facilities and resources for trade unionists, including information about Section 44, ventilation, making your workplaces safe, how to organise to close. We're backed by the Hazards campaign, which has got lots of information that you can use. We're also trying to set up local groups to lobby businesses, to lobby centrist and right-wing politicians, to convince a broader range of people about the aims of zero COVID, as has happened in other countries, particularly across the South Pacific, where this is not a political issue in the same way that it is here. The position is really, really shocking. And I think I'm probably one of the only people who've seen many, many people die of COVID. It's not something I would want anybody to see, and it's not something I would want anybody to suffer. And there's a lot that we can do, but it's really up to all of us in our workplaces, in our trade unions, in our local communities to do something about that and force the government position to change, but also to change things where we are. And that's what Zero COVID is about. Thanks.
Thank you very much, Emma, and thank you very much also for pointing to the concerns around over the vaccination rollout. I think at the moment the government are certainly making sure that that stays in the press as a means of detracting from everything else they're still meant to be doing to address this public health crisis. Our next speaker, which we will move straight on to, is Ramona McCartney from the People's Assembly Against Austerity. Ramona?
Hi, thanks very much, Belle, and thanks very much for inviting the People's Assembly to the discussion today. For those of you that know that are unfamiliar with the People's Assembly, you know that we have been campaigning around COVID since last March when we went into the first lockdown, really. Since then, we've organised online protests, rallies, held widely attended public broadcasts, trying to make sense of the crisis, really. And it became very clear to us, really, in the first part of last year, by talking and listening to medical doctors, scientists, unions, campaigners, and looking to other countries, that there were strategies that we could put in place to prevent the worst happening and could possibly soften the impact of COVID. But unfortunately, it seems that the government decided to take a totally different approach, and that is one that we're still trying to get our heads around and try to make sense of, unfortunately. Now, that was almost a whole year ago, and the fact that we're here today in this current situation is really a huge injustice, and it's an absolute failing of government. We've just had the highest amount of deaths in any one day in Britain, and that isn't some sort of phenomenon. It lies really with the disastrous rollout of government policies, and the government just seemingly fixated on putting business and profit ahead of the health and well-being of the nation. So I know that today in this session we're talking about the impact of lives and the impact on people. And two things that really come to my mind when I think about that really is what I've just mentioned before, is the disastrous decision making by the government, but also the impact of 10 years of brutal austerity. I don't think that we can forget about that, really. We are now witnessing the damage caused by a decade of austerity measures while we face this huge public health crisis. Our public services have been underfunded, they've been understaffed. This is now resulting in a huge system failure when we need those services. The impact that has had on society is very, very serious indeed. We just have to look at our healthcare workers. They're under worse pressure than ever before, thanks to successive government cuts in staffing and funding, as I said before, and the list goes on and on and on. There's one area actually that I wanted to talk about quickly, and that has a huge ripple effect, and it's something that has you know, as a result of this long-term austerity measure, and that is the lack of decent jobs in Britain today. We somehow have turned into a nation of the working poor, you know, when the majority of people in receipt of benefits have one or more in their household that are in full-time employment and yet cannot make ends meet. That is a national crisis and something that we need to take very seriously and look at erasing as soon as possible. When people are depending on food banks like never before, when people have to make decisions between eating and heating, when we have our kids going to school without winter coats, with holes in their shoes, with no food in their belly, that is a serious crisis. And that was before the pandemic, let's not forget that. It's just now things are much more grim when we're faced with this crisis. And one thing that we also should keep in our minds is that there's no lockdown for the lowest paid people. Millions of us are being forced into work in often dangerous circumstances because the government and the employers are putting profit way before our safety. And as a few speakers have pointed out before, this pandemic has definitely highlighted the scale of inequality in our society. And we have said many, many times before, the virus does not discriminate. It's the system that we live under actually that does the discrimination. And this pandemic highlights that. It's disproportionately affecting ethnic minorities and working class people. They are some of the people that are more likely to be going into the dangerous working workplaces. They're more likely to be living in overcrowded housing and not able to afford to take time off work because there's inadequate sick pay. I mean, to cap it all off, I think one of the worst things about this at the moment is that the government are now trying to blame us for the spread of the virus rather than looking at its own policies, and that is totally unacceptable. But just before I finish up, I would like if we could just remind ourselves that, you know, we do actually hold great power. And it was through our collective outrage, it was through our campaigning, it was through our unions fighting for us and defending us that we actually have been able to stop the government in the tracks on many different occasions and made some positive change. We can just look back at some of those examples, like around the A-levels debacle, the track and trace, PPE for NHS workers, the migrant health surcharge, the closing of schools. We can really affect change. So just on finishing, I would like to say that, you know, we have to fight for maximum safety now, which means a proper lockdown, but also for a new normal where working people aren't repeatedly made to pay for the crisis. So we have to organise now. We have to fight the government. We have to fight the employers. We need to fight austerity. And most importantly, we have to campaign creatively. Please do go onto the People's Assembly website, find a local group, join an organising meeting there where you can, there are ideas to campaign effectively and creatively within your community. And when it's safe to do so, join us on the streets where we will be calling a massive demonstration to challenge this government. So stay safe and thanks very much.
Thank you very much, Ramona. And our final speaker in this section is Louise Irvine from Keep Our NHS. Oh, you're on mute, Louise.
Oh, can you hear me?
Yes, I can.
Hi, my name's Louise Irvine. I'm a GP in London. And I'm speaking today on behalf of Keep Our NHS Public. I should also say that as a GP, I've seen the impact of COVID on my patients and on my colleagues, and also the colleagues I know who work in hospital who are really suffering. And also, as in my family, my father died of COVID, and both my husband and my mother were hospitalised, but have recovered. So I feel obviously very passionately about this issue. Keep Our NHS Public, COMP for short, has been campaigning for about 15 years for an NHS that's publicly provided, publicly funded and publicly accountable. We know the NHS has been underfunded, understaffed and has suffered from creeping privatisation that's fragmented it over the last decade and longer. During the COVID crisis, therefore, COMP has carried on highlighting the impact on the NHS of both of the underfunding and the lack of preparedness from the previous decade, but also in the COVID crisis, supporting our NHS and care staff exposing the failures of the private sector and the associated corruption of the way that they were awarded the contracts, and highlighting the unequal impact of COVID on people in our society, including on our Black and minority ethnic communities. So we're doing that as well as carrying on running our existing campaigns against privatisation, against hospital and service closures, against including the NHS in trade bills when we've been working with other organisations like ReOwn It, and in support of migrants' health rights, which is a very important campaign nationally and locally for us. COMP absolutely supports the zero COVID strategy, as this is the only way to have a set of coherent policies to crush the virus, to protect people's lives and well-being, and allow us to get our lives back. But we don't want to go back to the normal, as others have said. It's the old normal that led us to having the highest death rate from COVID in the world, that meant the NHS was so unprepared, it's been overwhelmed, and that has led to the horrific inequalities and the impact of this pandemic on our society. So we don't want to go back to normal. We want to go forward to a better society and learn lessons for the future from this dreadful pandemic and from our government's appalling response to it. And for that, we must continue fighting for an NHS that is publicly provided, publicly funded, adequately staffed, and we must end privatisation, and we must end social and health inequalities. In terms of current campaigning that COMP is involved in, I'm very excited to announce that COMP will make a contribution to this overall struggle by holding a People's COVID inquiry to be launched soon. We want a proper public inquiry, but we're not having that. We need to have an inquiry now so we can learn lessons now in real time. And so we can actually identify what's gone wrong, what changes we should be campaigning for now, because it's not too late for the government to embark on a zero COVID strategy. And most importantly, what we can learn for the future in order to rebuild our society, in order to rebuild the NHS, and to actually build a society that's healthier and fairer for all. So our People's Inquiry will have about 8 sessions over on a Saturday over the week, starting sometime in February when we launch. And we'll have expert witnesses, and we'll also have testimony from all people from all walks of life affected and impacted by COVID. We'll try to bring together all the evidence and all the material, all the arguments to a coherent whole so that we can actually hold the government to account, learn lessons now, identify the demands that we must be making in order to deal with the epidemic now, but also what we need to be doing moving forward into the future, as I said, to rebuild our NHS and to rebuild our society. Thank you.
Thank you very much, Louise. Thank you. So as you all know, the Zero COVID Coalition is a broad campaign jointly convened by Diane Abbott MP, who's brought us all here today with the Morning Star to oppose this government's reckless policies and to fight for a zero COVID strategy. And we're very pleased to have the Morning Star here with us today. Ben Chacko from the Morning Star is going to speak to us briefly before our final session of this event. Ben.
Thanks, Belle, and it's really good to be introducing the last bit of this event on fighting back. I was looking at the BBC yesterday, and they had a really scathing article about a year on from COVID in Wuhan, and how the city was marking a year since the disaster hit it, and they were describing exhibitions celebrating the successful elimination of the virus. The focus of that article was really on attacking China's claims about the virus. There was no reference to the standout point, which was, as we lived through a third lockdown, record levels of COVID infections and deaths in Britain, that whatever they did in Wuhan obviously worked rather better than what they've done over here. And if we'd done the same, then the shops, the bars, the restaurants, the gyms would be open again here too, and safely. The BBC report was sadly typical, because our government has shown no inclination to learn from other countries that have dealt more successfully with COVID than we have. And unfortunately, most of the media give them a free pass, blaming the public for high infection rates, when we're living through an economic and human crisis of the Tories making. The fight for a zero COVID strategy is not a fantasy. I think we've heard lots of excellent speakers explain why it is achievable. It has been achieved in many other countries that have done a much better job of tackling the virus than Britain has. And it's not too late to change track. We've seen countries like Australia that began by flirting with the crazy, dangerous ideas about herd immunity that we've seen over here, but learned from its mistakes, changed its strategy, looked at what neighbours like New Zealand were doing, and they've changed that approach very successfully and largely eliminated COVID in Australia. So what's the difference? The virus response, in my view, in Britain has been weak because of three main factors. One is the approach has been one of managing the virus at what are deemed politically acceptable levels rather than suppressing it. So suppressing it is obviously what we mean by a zero COVID strategy, but we've seen kind of partial lockdowns, the lockdown last autumn where schools remained open. Schools were only closed in this lockdown because the government faced a nationwide revolt by teachers after the NEU advised members not to enter unsafe workplaces. And of course, non-essential workplaces remain open, as Richard and other speakers have pointed out. The Observer published a really useful study recently showing many employers are forcing staff into workplaces when there's no need for them to be there. Cleaners and tradespeople are continuing to work in other people's homes, and the Health and Safety Executive has been so eviscerated by cuts that it cannot check whether workplaces that claim to be COVID secure actually are. As Professor Phil James of the Institute of Employment Rights noted in last week's Morning Star, in the first week of the current lockdown, the Health and Safety Executive received 2,945 reports of employers breaking coronavirus rules and putting their staff at risk. In response, it did nothing. This is one reason lockdowns don't actually suppress the virus. They do reduce infections. But since the government has not built effective test, trace, isolate and support measures, when they are lifted, the virus simply bounces back. This is why we're seeing repeated waves of infection and are currently at a third peak, which is the highest yet. And the failure to build those systems is linked to the second problem, which is what the British Medical Journal called rampant corruption. The Tories have handed essential health contracts and jobs to their mates, enriching an unscrupulous minority who are not qualified for the tasks they are given. We've blown huge sums of public money on inadequate or unusable PPE and on private companies with a record of failure. In the process, they've quickened and deepened an agenda of privatising and outsourcing public services, which takes us to point 3. The Tories are pursuing the exact policies which over decades have led to the British state being in no state to handle a pandemic. The part privatised, part outsourced NHS led to what We Own It exposed last year as a chaotic procurement process, hampering hospitals' ability to get what they need when they need it. Outsourcing services such as hospital cleaning contracts means super exploited workers on 0 hours contracts. They don't lack proper sick pay, so they don't dare to take time off if they feel ill. This, of course, is a problem in many workplaces, not just hospitals, and points to the huge damage done by Tory attacks on labour rights, which we heard about from the Belly Majinga campaign earlier. Millions live in a hand-to-mouth gig economy without proper contracts or job security. They fall through gaps in government support they cannot afford to isolate. The government won't address these problems because it remains wedded to restoring the pre-pandemic status quo as fast as possible. It's not prepared to take action that runs against the neoliberal logic of privatisation and outsourcing. It's not willing to close non-essential businesses and support their employees because it continues to place private profit above public health. So pressure has to be put on it to change course. We know it can be done. It U-turned on school openings because of industrial pressure. It's U-turned more than once on evictions because of public protest. Public opinion is in favour of tougher measures to tackle the virus, and the government's policy lacks public confidence. What we need to do is unite as many forces as possible behind demands for a new strategy, a zero COVID strategy, so that Parliament and in the media and in workplaces, the government is being challenged on its back to normal agenda everywhere by politicians, by scientists, and above all by organised workers in the workplace. The case for change is overwhelming. We need to force ministers to act on it. Thank you, Belle.
Thank you very, very much, Ben, for leading us very well into our final session, which is campaigning, resisting and fighting back. As I said earlier, our unions have been doing a fantastic job leading the charge. You're going to hear from a number of our unions today, starting with Jo Grady, who is the General Secretary of the UCU. Jo.
Thank you, Belle. You've been doing an absolutely amazing job of chairing today. So let's start with the basics, shall we? If there's one thing that has really characterised the UK's response to COVID, it has been an absolute steadfast refusal to learn. The government's handling has been disastrous and it has been lethal. At every point since the summer, when they've been presented with options, they have chosen the very worst and often the very most dangerous choice. They've gambled with lives, they've gambled with the NHS, they've gambled with the economy, and they want us to continue letting them gamble. They tell us they can't or they won't fund the things that we need to return to safety or even to facilitate what a COVID free and a COVID zero COVID UK would look like. But they have a bottomless pit of money to throw at their crony mates to develop technologies like the Serco track and trace, while simultaneously refusing to properly refund the things that we need. Many other speakers have covered why this is, so I'm not going to dwell on that. In education, we have asked for modest funding compared to what they've squandered elsewhere. And what has been the cost of them refusing to fund education? It has been tens of thousands of needless cases of COVID in our colleges and universities, way over 50,000. Tens of thousands of cases of COVID in our wider communities, which they were warned about. UCU back in August called upon the government all around the UK, all of our governments, not to allow the mass movement uncontrolled of people around to universities, and they did it anyway. And we saw with disastrous consequences, young people trapped in accommodation that they were already paying far too much to be in under lockdown. We've also seen, and this has been talked about quite a lot already today, as a consequence, huge shortages of vital medical supplies in our NHS to treat people, leading to completely undignified end of life. And why? Because our government would rather see this. They would rather see the horror that is currently all around us than fund things properly. Particularly with education, they are more wedded to a rotten funding model of education, even during a pandemic, than they are in literally saving lives. The result has been, in higher education, for one example, students demanded to be directed all around the UK like cattle to buttress the bank balances of universities. In some cases, universities have literally chartered planes to bring international students to the UK during a pandemic because their fees are valued more highly than their lives or their mental well-being. Students have been treated abysmally. They've been treated contemptuously, not by their staff, who've actually been treated just as contemptuously by this government. Staff have been subjected to unbearable, unpredictable and unsafe working conditions at the very same time as trying to do the best for their students that the government have disregarded. In schools and in colleges, students have been denied technology, and this has been the same in our prisons as well, for prison learners who've been denied essential in-cell technology to continue learning. But most shamefully, in schools and also in our colleges, our most deprived students have been denied food. They've been denied the dignity of having their food portioned up and delivered to them in coin bags. Because what we've seen from this government is they would rather funnel money to private companies to administer that process. And this is where we currently find ourselves, a government who will not channel funding where it's needed, who want to bamboozle the public into thinking either they are to blame or they are the ones who can do things to keep us safe. And a few examples of this would be the lateral flow tests. They are trying to use lateral flow tests to force people back into unsafe classrooms, unsafe labs, offices, lecture theatres, when we know they're not safe. And they're doing this because they are using these things as a prop. They are using education as a prop. They're using student mental well-being as a prop. But they don't care about any of those things, because if they did, they would fund the system properly so that we can make sensible choices, save lives and deliver education. With all that said, we collectively have answers. Our government won't listen to science, they've demonstrated that. They won't prioritise safety, but in trade unions, in workplaces, we have been doing all of those things. In UCU in particular, our union has led a tireless campaign since the summer to move teaching online. In some areas, we've been incredibly successful. In areas where we haven't yet been, we will not stop. We are organising members on the ground to push back against unsafe conditions. As I say, in some places, particularly in universities, teaching has been moved online for the remainder of the year. And we're doing our best in other sectors too. What I want to end by saying is, you are crucial to helping organise. I know many people are tired. We're 10 months into a pandemic. The government is invested in keeping you tired and demoralised. But we have to do things differently. Talk to people, use the language that makes sense to them about zero COVID, use the resources that have been made available by zero COVID. Talk to people about their hopes and fears, talk to them about how we might get to a better place soon. And very quickly, I'll just say this before I wrap up. My good friend and a woman who I very much admire, Larissa Kennedy, and she's later on in this panel, she's the NUS president. At the very beginning of COVID, she talked to me about Arundhati Roy and a quotation of his that the pandemic is a portal. Well, we are in control of where that portal delivers us. And there's no shortcuts to fundamental, long-lasting change. So you need to take energy from today. You need to look at the resources available and get organised. If you have a union, get organised in that. If there isn't one in your workplace, start organising with your colleagues. It's time to start now and take control back. Thanks.
Thank you very much, Jo. And that is absolutely the message. We need to get organised right now. We're going to go to our next speaker, Howard Beckett from Unite. Howard.
Well, thank you. And thank you for sharing today. And thanks to Diane and the Morning Star for putting this event on. It's absolutely crucial. And Belle, I'm sure that plenty of people who are on the webinar today will ask the question as to whether or not this is the right time to be having this discussion. And of course it is. The truth is that the government is massaging statistics out there on any proper analysis that would be well in excess of 115,000 people who have died from COVID at the moment. And the truth is as well that the government is fixated on over 80s, when at the moment in the ICU, we have more males in their 30s than we have people in their 80s. We are at the peak of a crisis, and it can only get worse if we allow the government to control the narrative. And the reality is that it is zero COVID against herd immunity. The government at this moment in time is playing a gamble with the vaccinations, moving from 3 weeks to 12 weeks in reference to the second vaccination, is playing the ultimate herd immunity gamble. And it is the reason as to why the zero COVID narrative is so important right now. As we heard from Richard earlier on, we are seeing more deaths in a week than the entire Asian countries are seeing throughout this pandemic, those who followed zero COVID. And those deaths, sadly, are amongst the working class people. It is our health workers at the front line, our care workers, our teachers, our construction workers, our bus drivers, who are losing their lives as a consequence of COVID. And coming out of COVID, they will be asked to lose their jobs and their terms and conditions. And that is the failure of government. The furlough scheme started life off as the job retention scheme, but no longer known as the job retention scheme, simply a facility to put people at home until such time as their jobs are taken off them. And that is the fight that we now have as working class people. We must make the argument now for zero COVID. That means a full lockdown. It means the shutting of nurseries and the shutting of schools. We must make the argument that low paid workers must not be forced into work because they cannot afford to stay at home. We must make the argument that the job retention scheme is exactly that the facility of employers receiving funds means that people are maintained in jobs after this crisis is over. And Belle, that is the struggle that we lie ahead now for the trade union movement. Can we own this narrative? We've shown that we can fight at the peak of this crisis in respect of people's rights to come home from work alive. Section 44 and Section 100, extraordinary that in the Human Rights Act, anybody would even have thought of the need to write in Article 2 the right to life. But it exists in writing, and as a trade union movement, we have upheld it. And it's the reason why Unite have had over 20 places of work where we have walked out because of the reality that workers' lives are being put at risk. It is only by the collective ownership of this from workers through the trade union movement that we can make this fight. And coming out of this crisis, we now have to face the reality that it will be a binary choice between whether or not workers pay for this or whether or not wealth pays for this crisis. And we must make the argument that wealth must pay for this crisis. And it's why, Bell, at this moment in time, Unite have disputes up and down our nations. We have dispute in Tesco's with our Livingston drivers. We have dispute at Uptown in the Northeast. Everyone knows the dispute of Rolls-Royce in Barnoldswick. We have a dispute at Heathrow. We have a dispute with British Airways. We have a dispute in Mourne Local Authority. And we will make the demand for health workers to receive their 15% pay rise as they are entitled to, because this is the moment when trade unions need to be brave. We need to look at what happened after the Second World War and accept the reality that people of the 30s returned in 1946 and built a social state, built the NHS, and importantly demanded that their children have the right to third-tier education. And that is the challenge that we now face, all of us collectively face. The reality, Bell, of zero COVID is that it is a socialist solution to this crisis that we face. And the reality, Bell, for all of us within the trade union movement is that if government isn't going to change, if those other than the politicians who are on this call, if those politicians are not going to speak for working people, then the trade unions must get together and say that they demand a better future, they demand an end to the inequality of society, and they demand a solution from COVID that reflects the fact that it is only workers who have kept our nations going at the height of crisis. Thank you, Bell.
Thank you very much, Howard. I think that leads quite well into our next speaker, is from another union that has been fighting for workplace safety throughout this pandemic, and that's Ricardo Latorre from the FBU. Ricardo.
Hi, thank you, Bell, and thanks for inviting us to this incredibly important meeting today. I want to speak today about the particular struggles and fight for safety that firefighters and emergency control staff have been facing in the FRS, very much on the front line of this pandemic throughout. And many of you may have seen this struggle blow up in the press over the last few days as fire bosses, hand in hand with the government, have stepped up and made this vicious and dishonest attack on firefighters. And it's a very clear example of just how deep the political and the anti-worker agenda runs behind these attacks on our safety and this lack of action on worker safety. And our particular struggle in the fire service goes right back to the beginning of this pandemic. And as far back as February and March last year, the Fire Brigade Union entered into a discussion about how the fire service can be best placed in responding to this pandemic, being very aware that much like all other public services, we're going into this incredibly under-resourced, incredibly underprepared for a crisis this size as a result of the 10 years of cuts and austerity that we've seen. And in that discussion, we identified that, of course, firstly, the best way we can support our communities throughout this crisis is to remain out there, protect our core functions, our core service, and remain out there on the front line every day, protecting our communities from fires, floods, and all the other hazards that we do, which still very much exist throughout this pandemic. But beyond that, in recognition of firefighters are incredibly high skilled and versatile professionals, we felt there may be additional ways in which we could assist in the wider national COVID response. So we entered into an agreement with fire service employers and with chief fire officers about what additional activities voluntarily outside of our contract and our core duties we can deliver to assist other services and the public throughout this. And that led to firefighters volunteering for some incredibly difficult tasks. So we've driven hundreds of thousands of ambulances, trained care homes in PPE. We've moved thousands of dead bodies, and incredibly difficult tasks to ask of people. What the agreement allowed was for that to be delivered, one, with all the employment protections we needed when stepping outside of our normal contractual role, but vitally the safety that we needed to be able to deliver those activities safely for us doing the work and for those people that we were helping and we were assisting. Because, you know, this is no joke. No matter how some bosses may wish to present this, just because we face risks in other areas of our job, firefighters aren't immune from this. COVID doesn't stop at the fire station door. Firefighters have become seriously ill with COVID. Firefighters have sadly died from COVID. This safety is not a game to us. And one of the particular safety measures that was in this agreement, and what we're now seeing bosses and employers push back on, was this need to stop the transmission of COVID between workplaces. We didn't want our people carrying COVID into these settings and to the vulnerable people we're trying to assist, and we didn't want volunteers bringing this potentially deadly virus from those high-risk settings back into fire stations either. So we agreed a very simple control measure that the volunteers, after being detached in mortuaries, hospitals, ambulances, transferring patients, when they came back, they simply take the more accurate PCR test and return to the fire station on the negative result, ensuring that they didn't have this infection. And it's been proven to work. We've had volunteers return, undertake that control measure, take the test, be identified to have been positive as a result of their volunteering, safely isolated. That infection never went in to the fire service. Fire bosses started to push back. They were saying it wasn't easy enough, it cost too much, it was unnecessary, but most they were saying it was unsustainable. So it became very clear we weren't having a safety-based conversation about risk here. We were talking about finances and resources. That being said, we didn't think it was unsustainable and we thought it was necessary, and it was proven to have worked. The Fire Brigade Union entered into a review period to see if there were equally safe alternatives to help this work continue, because firefighters want to do this work, but we want to do it safely for everyone. It was during those talks that employers, working with fire chiefs, unilaterally terminated that agreement, ripped up the safety measures and walked away. And most shockingly, tried to blame the Fire Brigade Union for doing so, even though we were in talks the whole time and believed that those talks were continuing. So now in those cases I just mentioned, when firefighters return from these high-risk settings with COVID, without that control measure being in place, it's almost certainly that infection will be taken back into fire services, households, and onwards. Completely unacceptable. And most conveniently, the government's inspectorate, Her Majesty's Inspectorate, released a report into the Fire and Rescue Services response to COVID, full of falsehoods and mistruths, completely dismissing the fantastic work that firefighters have delivered throughout this pandemic voluntarily, and then conveniently goes on to make repeat recommendations around how we need to change how the apparatus, how firefighters bargain on pay and conditions and involvement of the union. And you'd be very correct to wonder what the hell that has to do with COVID and safety, yet it becomes very apparent what the agenda behind this is. And that has been backed up by the mainstream press repeating these lies, repeating these mistruths. And the inspectorate, who is supposedly independent, did not come to us at once to discuss the particular safety breakdown before reporting the boss's side of what had happened. We're now organising nationally on how we respond to this. We're meeting members in every part of the country, and we've seen the support from other unions, from some Labour MPs already, and we very much appreciate that, and we continue to ask for your solidarity and support. But I would end on this, and I'm going to repeat a point that Joe just made because it's incredibly important. The most important thing any worker can do right now for their safety in the workplace to push the demands of zero COVID is to join a union if they haven't done so already. Belle pointed out earlier the U-turns that we can force when we are organised. So join a union, convince colleagues to join a union if they haven't already, and most importantly, become active in that union. When we are organised, we do not have to make apologies about being combative in our workplaces in this situation. This is a matter of safety, health, and life and death. We can force these unions. We can make our workplaces safer. We're the only thing in between this virus and workers at times. So that my final demand on this would be join a union, become active in your unions, convince workmates to do the same. Thank you, Belle.
Thank you, Ricardo. Absolutely. Join a union. Now we'll move on quickly to our next speaker, Pascal Robinson from We Own It. Pascal.
Hi, thanks so much for having me. I just wanted to introduce We Own It really quickly. So We Own It campaigns for public services for people, not profit. And being on this call has been amazing to see all of the amazing public service workers doing those things and working for people, not profit. So we campaign for public services, railways, water, council services to the NHS. And we believe that public services are the best things that humans have ever created. We've had several victories, including winning our campaign to stop the privatisation of the body NHS professionals, and most recently succeeding in our campaign to get probation brought back into public ownership. And the reason that we're able to win those campaigns is because the majority of people agree that public services should be run for people and not profit. And I want to speak to you today about why any people's plan, any recovery plan, and any plan to suppress this virus requires us to invest in public services. We can't be duped into this government's narrative that there is no difference between private and public and that it's a case of all hands on deck. This is quite simply code for giving more contracts to their friends and to all manner of private companies, and it just won't work. So it's clear that privatisation of our services is a joke, it's a scam, and it rips off our communities. Privatised services and markets have failed to tackle the challenges of the 21st century, and they left our public services creaking, even before this pandemic. And the trauma and stress that health workers are going through right now can be directly linked to those policies of reducing beds, selling off land, etc. And now we're giving private hospitals extortionate amounts to rent beds that should have been in the health service anyway. Similarly, when it came to getting workers PPE, the NHS supply chain was privatised in 2006, and groups like Public Matters have shown that this is a long-term plan, but private companies themselves are very happy to admit that this is their aim, to get their claws into our NHS and to undermine it and divert funds to them. And I should say that I promise I'm getting on to hope soon. So We Own It wrote a report that highlighted that our supply chain and procurement is now a mishmash of private outsourced contractors, and there are 4 levels of profit taking before any PPE gets to a care home or a staff member. And of course, this was meant to be driving efficiency savings, and it did the exact opposite. PPE was rationed and there wasn't enough of it. And Test and Trace was a similar story, with each part of the chain handed to private companies to make money at every point possible. So we know that this hasn't worked, but we've also seen amazing resistance. So We Own It started a campaign last year to scrap Serco and save lives. And people have fought back. We've seen people at their town halls demanding not a penny more to Serco. We've seen people writing to their local leaders and shaming Matt Hancock in every platform possible, asking him to fund local public health teams. And while we've seen that this privatised contact tracing system is still sucking private money, local government resisted by setting up their own local contact tracing operations. And the government, many ministers and government decisions were forced to admit that local government needs to expand these operations because that is what has worked. Skilled professionals embedded in their communities, able to offer flexible support. But of course, our test and trace system is still not functioning at all, and the government is still trying to assert that it is. Matt Hancock says it's working very well, but we know full well that we have to keep pushing them to scrap private companies from test and trace, as we're learning more and more every day that vaccines are not going to fix everything. So I think that while we're fighting for test and trace to be in public hands, this has to be part of a wider fight for an NHS completely in public hands. It's our only hope of getting out of this mess in the medium and long term. And Coral Jones earlier in this call around 12:30, for anyone who wants to look back, offered some really important fronts that we need to be fighting on: ridding the NHS of the vile hostile environment policies and resisting integrated care systems, which will likely give private companies an even bigger stake and control. Beyond that, we cannot think that there isn't enough money to fund the NHS, primary care services and local authorities. Spending billions on private sector capacity will only reduce NHS capacity. It's short-sighted and self-defeating, and it will reduce our resilience. And as we've seen in the last few months, it's well-funded public services and the amazing workers within them that offer us a way out of this crisis. And they're the people that hopefully, to everyone on this call, they're certainly giving me a lot of hope. So thanks so much, and I'll stop there.
Thank you very much, Pascal. We are, I can see, already going to run it a tiny bit over time. We still have a few thousand people watching across our various platforms and tweeting about the event using hashtag #ZeroCovid. We're going to go straight on to our next speaker because we want to get all of our fantastic speakers in. We have Matt Wilgris from Arise. Matt.
Oh, thank you, Belle, and what a great event, and big congratulations to Team Diane and the Morning Star. Our daily voice in the bourgeois press as a whole doesn't want to talk about what's going on in COVID, and the Morning Star is essential antidote. I'd like to speak today on behalf of Arise, which is a Labour left organisation, and we're delighted to be on this platform with so many fighting trade unions and trade unionist campaigns like the People's Assembly and Keep Our NHS Public, and our great partners in Momentum who do so much work organising in our party and our communities for a socialist solution to the current crisis. And that's what I'd really like to say in the short time we have. The zero COVID approach is the right approach. It's the approach we need. It's the approach that Labour should be standing for, as the Labour Party of New Zealand has done so heroically, giving like a leadership to the world. And part of that also has to be, as other speakers have mentioned, an economic support to people, to enable people that need to stay at home, who need to isolate, to be able to do so. And what a disgrace it is that like a year into this scandal, a year into this crisis, do we have the scandal, where statutory sick pay still at such a low level, one of the lowest rates in the world. And it needs to be at least tripled to become a living wage. But also, what a scandal is that millions of people still don't know, who are on universal credit, who rely on it for their livelihoods, if they're going to have the £1,000 a year, £20 a week cut or not in only a few months' time. Surely even this government, this callous Tory government, should raise sick pay and say there won't be any cut to universal credit. Because in the end, if people can't isolate, if they can't stay at home, then we can't break the chains of infections and we can't drive down the levels of the virus. And so something that I'll be putting in the chat on Zoom in a minute, and I'd really urge you to sign, is a petition supported by Diane, by Jeremy Corbyn and John McDonnell called Workers Can't Wait, because people can't wait till the budget in March for that economic support. They need to know now that they won't be evicted from their homes. They need to know now that they don't have to pay tuition fees that shouldn't be charged. They need to know now that the universal credit cut isn't coming, and they need to know now that if they need statutory sick pay, they can get it, which means that people can't, and that it's at a decent level. The other thing I would say is that we need to speak about what kind of society we live in. How can it be that in one of the richest countries in the world that we have the worst death rate in the world on this COVID crisis? How can that be? Why can it not be that the state and the money being spent and the resources being directed aren't about saving lives and letting people have a decent and proper life? And that's what I'd like to conclude with, because I'm not going to take up all my time. There's a lot of speakers, an excellent meeting, experts on health, brilliant trade unionists fighting back for their members. All I'll say is, why can't things be different? We have to make things different. It's a choice. Boris Johnson, the 1% first all the time. It's a choice to put private profit and monopoly capital before ordinary people. We need to propose socialist solutions. We need a people's plan for the economy, and we need to demand of the Chancellor the workers can't wait. So please sign our petition, and thank you very much, Diane and the Morning Star, for organising this excellent meeting.
Thank you, Matt. Thank you very much. And Matt, as you mentioned, Momentum have been doing fantastic work as usual, and we're pleased to hear from Sonali Bhattacharya from Momentum next. Sonali?
Hi, Belle. Thanks for having me. Sonali's got an invisible H. It's good. It's great. It's great to be here, and it's fantastic to hear from all the brilliant speakers. Thank you so much. So it's clear we must expose the government corruption and pursuit of profit and callous disregard for human life that has led to the UK overseeing 100,000 deaths, as other speakers have spoken about this morning. We need to campaign for a zero COVID strategy to save lives, health, jobs, homes and living standards now, but we also need to demand the post-COVID build back is based on social justice and equality. So in Momentum, what we're doing is helping to highlight Tory cronyism and corruption with our communications. Our aim is not just to expose this, but also to popularise the understanding of what lies beneath these scandals. We know that decades of underinvestment and privatisation of our public services have left us vulnerable to the pandemic, and that Tory doubling down on this flawed ideology has compounded this catastrophe. So on the National Coordinating Group of Momentum, we're committed to continuing to push a socialist agenda within the Labour Party, but also looking outwards to campaign in our communities and workplaces. We know that grassroots members are central to effective organising, and local organising has become even more vital during the pandemic. So we've been working to refound local momentum groups, supporting members to become organisers and fostering democratic decision-making on local campaign priorities. This has allowed us to continue building power at a grassroots level. And our goal is for momentum groups to become socialist hubs with the skills and support to campaign against cuts, food poverty, NHS privatisation, unemployment and evictions, which have become so much more rampant over the pandemic. Allowing the virus to spread has made it easier for bosses to lay off workers, cut pay, fire and rehire, and force workers into unsafe conditions, as we've heard from so eloquently from trade unionists here today. We have the second lowest statutory sick pay in Europe. The inadequate furlough offered to workers has pushed many into poverty, and millions haven't even been able to access it. The 5-week wait for universal credit is pushing people into destitution, and food bank usage has soared. So trade union organising is crucial, as we have heard today. And we've seen the incredible work of unions such as the NEU, Unite and FBU Comrades, with members collectively organising to protect not just their own health and safety, but that of people across their communities, as well as showing incredible solidarity with NHS and other public sector workers, Momentum will soon be organising a trade unionist network, a home for rank and file trade unionists, whatever their union, with a focus on developing and sharing organising skills and driving up trade union recruitment within our mass membership. As others have said, we should not be calling for a return to normal. The working class cannot be expected to pay for this disaster. Austerity helped create the conditions for the UK's coronavirus catastrophe, and we're already hearing government ministers clamouring for cuts again. We're seeing migrants and people of colour increasingly scapegoated, even as disproportionately high numbers of us are dying from this virus. The hard-won rights of disabled campaigners, which have been fought for over years, have been eroded in a matter of months. So we have to reject the racist and ableist policies that are implemented to divide us. And we need to recognise that these policies support an economic system that harms all of us except the super rich. So this year's Labour Party conference will be a crucial arena for our movement to defend and expand upon the advances that we made in 2017 and 2019. We've just launched our first ever democratic policy platform with local groups, affiliate and campaign organisations invited to draft and submit motions that they want Momentum to prioritise, ending with an OMOV ballot of all of our members. This is our chance to create a manifesto by the movement. Only we on the left have the ideas to meet the triple challenge of COVID, climate catastrophe and capitalism. Zero COVID must be a call to arms, not just to eliminate the virus, but to eliminate the broken system that has allowed it to proliferate. To organise in our communities and workplaces, to demand all workers are paid fairly and have safe working conditions, that the role of key workers is acknowledged and appreciated. The poverty, hunger, precarity of work and shelter are no longer used as a weapon. This is our opportunity to not just demand that public health is put before profit, but our chance to build a broad-based movement for social justice and equality. Thanks so much, everyone.
Thank you so much, Shonali. We're going to go straight to Larissa Kennedy, who is the president of the National Union of Students. Larissa.
Thank you so much, Belle. As was just said, my name is Larissa, my pronouns are she, her, and I have the joy and privilege of being president of the National Union of Students. And I'm really grateful for the space to speak alongside so many incredible organisers and trade unionists. And just to kick off for myself, I want to set the scene for why students are fighting back so powerfully in this moment, because since I stepped into this role in July, as students, we've been responding to this government lurching from crisis to crisis in relation to students in this pandemic, from the classist, racist, ableist moderation of A-levels over the summer to where we find ourselves now, with students bankrolling university mega landlords and private landlords, in many cases without access to the housing that they're paying for. This pandemic has repeatedly exposed and exacerbated the fundamental flaws in our education system and in our world. When it comes to students, it's abundantly clear that this government sees pound signs where they should see people, because students have essentially been treated as cash cows from the get-go. You know, over the summer, we were repeatedly asking what is safely possible, and immunocompromised and disabled students, Black and brown students, student carers, our staff counterparts, and all those who were disproportionately impacted by this pandemic were ignored and invisibilized, and all of us were told to return to uni, in some cases forced into attending in-person teaching for monitoring purposes. And of course, all of that took place so that the government and universities could exploit students for fees and rent. And of course, all of this went horribly wrong, with lots of students and staff contracting the virus and then being trapped in student lockdown, struggling to access food and basic resources. And after all of that chaos, now we're in a position where, as we'd asked for, students are learning remotely, but without the investment in digital infrastructure to make this learning accessible. And our data shows that 13% of students can't even access their learning. And of course, this digital poverty is largely impacting disabled students, students from working class communities, and other marginalized groups. And all of the anxiety and financial difficulty surrounding this chaos has been exacerbating an existing student mental health crisis. It's piled on top of the issues that students were facing with hyper-securitization and the impacts of the hostile environment at our universities and at our colleges. And you know, this is disproportionately impacting students of color and international students. And it's furthered students feeling like pound signs, not people. And at every turn, every decision that government and university management have made has not been about access to education. It's not been about student, staff and community safety. It's been rooted in market logics. It's been about fat cat vice chancellors making sure they still get their astronomical paychecks, regardless of the impact on literally anyone else. Definitely with no care for the 9% of students who've had to access food banks just to survive throughout this pandemic, nor for the precarious workers who've been literally students' lifelines in many cases throughout this pandemic, and yet are being laid off in some cases. And at the core of this is the need for government to recognise education as a right and as a public good, and to treat it as such. We need investment in education, and we need redress for the exploitation that students have faced. And that's why at the National Union of Students, one of our core demands is that the government, and in fact the Treasury, step up to provide a financial support package that covers rent rebates and addresses the broader injustice of economic exploitation and financial hardship that students continue to face, so that we can stay home and isolate, so that we can play our part in ending this pandemic. And you know, I was listening earlier to Jeremy's speech, and Belle mentioned that there will be a generation of people demanding free broadband as a universal right. Well, that generation is here and the time is now, because another of our core demands is not only for free broadband for students across further and higher education, but also a broader investment in that digital infrastructure that makes online learning accessible. We need a zero COVID strategy, because the way that students, staff and communities, pretty much all of us, have been failed by this government is rooted in the prioritisation of profit over our safety, our health and our communities. And the student movement is fighting back. Here in the UK, the Students Deserve Better campaign has a petition demanding that students get economic justice, academic justice, and more, which I will share once I wrap up. Students across the country have been setting up mutual aid communities. Student organisers are piling the pressure on with the biggest wave of rent strikes we've ever seen. And we are pushed on by the knowledge that this fight goes beyond us. And we stand in solidarity with the global student movement, fighting against our collective exploitation, against tuition fees, and fighting for justice. Joe Grady, the ever impressive Gen Sec of ECU, I really appreciate that shout out before where you mentioned that Arundhati Roy quote that I often come back to, that this pandemic's a portal and that it's up to us where it takes us. And that spurs me on to state unequivocally that students are not willing to go back to normal. We have inherited a broken education system that prioritizes profit over people. We are not willing to tinker at the edges, nor to accept crumbs when we could go after the whole cake. We know that what we're experiencing here and now is the tip of the iceberg. And it's indicative of an education system rotting at its core. Now is the time to grasp at the root of this injustice. It's the time to be radical, to be visionary, and to build a new vision for education, but also for our world. And over the past few months, we've held town halls, we've held phone banks, we've held rallies, and we're ready to organise and to take even more action in the coming months to deliver the education system and the world that we're envisioning. The education system we will deserve, a demarketised, democratised, decolonised education system that is fully funded, lifelong, truly accessible, and that belongs to the students, staff and communities that it serves, and a zero COVID world that centres health, community and solidarity. So to wrap up there, my rage and solidarity is with everyone on the call. I really hope that you will throw your support behind the resistance from the student movement, the Students Deserve Better campaign, and our demands of the Treasury, the student rent strikes, and local organisers' demands of management, and our collective broader efforts towards a zero COVID world. Thank you.
Thank you very much, Larissa, and for all you continue to do as the President of the NUS, only having started in July, probably a very difficult time for you to come and be doing fantastically well, and everybody sees it. So our final speaker in this section, and before we hand over to Diane Abbott MP, is Helen O'Connor from the GMB Union Southern Region. Helen.
Thank you very much, Belle. And I want to start by thanking you all for the support and the solidarity you've shown for the GMB British gas dispute. Your support has given our members a real boost and real confidence to continue their struggle against plans to fire and rehire them and worse pay terms and conditions. And I think the one thing that's worth drawing out in this discussion is that this current lockdown is far less rigorous than the first one. The government has been dragged kicking and screaming to impose the current national lockdown. And this was in spite of the fact that a child of 4 could have told them that further and worse waves of this pandemic was coming. We could go further and say that it wasn't just a case that their inaction has made this wave far worse, far greater and more deadly than it could have been. We can say that their policies directly contributed to the disaster we are now facing. Once again, even though we are in a national lockdown, the government has refused to close non-essential workplaces like offices, the construction industry, and even human resources departments in the NHS. The definition of key worker or exempted worker is now so elastic, it makes a mockery of effective public health control. There has been little in the way of effective financial support for struggling workers, and on a daily basis, GMB members delivering critical services are reporting serious breaches of health and safety inside their own workplaces. For example, non-emergency ambulance transport members tell us that COVID and non-COVID ambulances and crews are being swapped around in the course of one day. There's lack of adequate cleaning in the COVID infected areas. NHS workers are telling us they're being put under pressure by bullying managers to go into work when they should be self-isolating or shielding, and NHS back office staff are expected to travel into hospitals and physically present for work, even under national lockdown conditions, so that targets can be met. Personal protective equipment is insufficient to protect our NHS members, some of who are now getting really sick from this virus. So it's clear that even though the rest of us have to stick to rigid lockdown conditions, this government is failing to control the spread of the virus because they're letting negligent employers off the hook. It is clear that the corporate allies of this Tory government care about the health of their own financial balance sheets, but they don't care about the health of workers or the wider community. And one of the lessons we've learned during this pandemic is you can't privatise the response to it. And this has been exposed in the failure of the test, track and trace system. And decades of cuts to the NHS and public services have left this country ill-equipped to deal with the biggest crisis since the Second World War. I want to take this opportunity to acknowledge the British Medical Association for standing up against untested plans to space out the vaccine doses to 12 weeks and for delivering on their professional duty as doctors to safeguard public health, because so many who know better and who should be standing up and speaking out to protect the population are silent right now with deadly consequences. So in our movement, we need to unite around a set of common demands that include ending all privatisations and bringing outsourced workers back in-house on decent pay terms and conditions, a zero COVID strategy designed to actually end the pandemic and not just manage it in the interests of private companies, full financial support for all workers, including full payment of wages for sickness periods, a fair and equitable benefit system, and a fully funded NHS with properly paid and trained staff. The only way we will effectively hold this negligent Tory government to account is through developing a united strategy based around these common demands, and by implementing effective organising that draws new layers of people in and builds our movement, and by linking up campaigns and trade union disputes. And that's the only way we can rebuild power to take on the privateers and the corporate managers who are destroying this country. The pandemic has revealed to any reasonable person that we cannot go on like this. We have found ourselves in a situation where fairness, equality, and rights have been trampled upon for decades now. But the real lesson of the pandemic is a simple one. If we do not take on and turn back the tide of privatisation, attacks on employment rights, and stand up in the interests of the public sector against rampant profiteering, and set out policies capable of providing a safe and healthy life for everyone in society, then this pandemic won't be the last major public health disaster we face. The movement is capable of meeting these challenges. There is so much human potential out there that is as yet untapped. We need to open up our trade unions and our entire movement to new layers of working class people, welcome them in, give them the space, give them the voice to help to build our movement, and offer them the opportunities to develop themselves into leaders. Growing numbers of working people in this country are changing because of these conditions that we're now living under. Many of these people can be convinced to be active in our movement, if not for themselves, then for their kids and for the future, good of future generations. So the job now is to organise to fight for what our people, the working class, need and deserve. But that fight will need to be based around clear and consistent demands, unity and solidarity. Thank you.
Thank you very much, Helen, and thank you for all the GMB are doing to stop this disgraceful fire and a rehire contract. We know that if it's done in one company, it won't be long before it's taken everywhere else. So thank you to all the speakers across the event today. You've been absolutely fantastic. As an MP, I have to listen to a variety of ministers' briefings, and I can tell you that I've learnt more in this past 2 hours than I have from any one of them. So it's left me just to thank you all for your patience during this time. Thank all of the speakers again, and thank you to Diane Abbott and the Morning Star, who have been put together this coalition and leading this coalition for a zero COVID strategy. There is so much more work that needs to be done, but as we've heard from a lot of the organisations and individuals that have spoken today, you know, there is a lot going on, and we are making headway. It's not too late for us to have a zero COVID strategy in this country. saving lives and saving livelihoods. Thank you very much, everybody, and enjoy the rest of your Sunday afternoon.